Hi. Our trust team has done a ton of great research on building trust, countering misinformation, and improving public health communication. But there's often no better expert than the practitioners themselves. Stick around to hear more from my conversation with Adam and Benjamin discussing their experiences at Baltimore City Health Department during the COVID-19 pandemic. Adam and Benjamin, it's so good to see you both and to talk to you guys today. So first, for those who are watching, please introduce yourselves and describe your roles with regards to public health communications for Baltimore City during COVID-19. And let's start with Adam.
My name is Adam Abadir. I had the pleasure of serving as the Director of Communications for the Baltimore City Health Department. I started approximately in November of 2019, and approximately 6 weeks before the first COVID cases were beginning to be reported. And I happened to be in that operation during for 2 years, leaving in around 2020, the end of 2021.
My name is Benjamin Young-Savage, and I worked with Adam. I ran all of the social media and did all of the graphic design work for the Baltimore City Department of Health Department. And I did a lot of the concept work, and Adam did a lot of the writing for a lot of the campaigns that we produced.
Great to hear. And tell me a little bit more about your communication strategy or philosophy during COVID-19. I mean, Baltimore City was very unique and even acclaimed, I would say, for their online and offline tactics, but humor can be a double-edged sword in health communication, so I'd love for you all to perhaps share how you incorporated it successfully so other health departments can learn from that experience.
I'll take a stab at it, but we both played incredibly important roles in. First of all, I would say that it was an iterative process. We were challenged by what we were seeing, and we were able to learn both from what people were telling us on social media, as well as learning from some of our mistakes in order to essentially better address the concerns that were coming towards us. But in terms of the philosophy, I think I'd start by saying trust in public health is absolutely paramount. You really want to make sure that the people that you are communicating with trust you. And sometimes that's really hard, especially as government, especially in public health crises. When you think about the history of this country, we think about the ways that vaccination campaigns have gone historically, sometimes not to the benefit of everyone. So sometimes that trust is also recognizing that perhaps we are not, as the communicators for the public health department, the best communicators. And I think one of the first things that we started really thinking about after, really trying to get information out as accurately and as quickly as possible is recognizing that we need to involve more people into this conversation. We need to make sure that if we are having, ideas around why vaccinations are important, it might not be as appropriate for the health commissioner to say this. Maybe it needs to come from a friend or a loved one or a trusted colleague. And once we sort of open ourselves to that idea, memes and other ways of getting off of the internet and into people's phones became a really key role in getting not only the information out, but information out in a way that came from actual trusted messengers, which included, friends and family. And I think that spoke a lot to our philosophy at the time of we are a collection of experts. We're trying our best. But at the same time, there are other ways that we can involve community stakeholders to increase that engagement and answer people's questions.
And I'll echo that. So anybody can be funny, but we chose to be funny in an informed and authentic way. We could have just jumped in and started swinging and had jokes and memes, but that's not actually what we chose to do. I think that's what we got popular for, but our strategy was deeply rooted in the science. Adam and I set up a Slack channel specifically where we had all of the experts at our disposal from the entire health department. And so that whenever anybody asked a question to us online, whether it was in jest or whether it was something very serious, we had a panel of experts at our beck and call to immediately answer those questions. And so we were able to respond with lightning speed to a lot of real hesitancies and a lot of fears that people had. And we also chose to lead with empathy. We understood that Baltimore has a very legitimate mistrust of medicine, given the history of Henrietta Lacks, of the segregation of Baltimore, of forced vaccination in the streets during other pandemics in the past. Those things have left trauma marks on Baltimore, especially when it comes to the racial segregation. And so we couldn't just jump in and start swinging with comedy. We had to come from a place where we were honest about the science and we were honest and empathetic with people. I mean, one of the first things that we did when we were together is we dragged one of our own former health commissioners. There was a health commissioner who had extremely racist, sexist, anti-Semitic, anti-immigrant points of views, and used those views and to form policies in Baltimore City. And so we wrote an entire thread dragging him and just saying, you know what? This is our actual past. We understand that it's hard to trust us, and we are going to own up to it and not try to hide it or gloss over it with some humor. Now, in terms of philosophy, we took a lot of pointers from some very famous and very successful marketing brands. Wendy's had an amazing account. Steakum still has an amazing account. And we chose to use that kind of humor, that kind of disdain for authority in our messaging, because we understood that the public was just tired. They were tired of being fed bland and boring and monotonous information that wasn't really applicable to them. And so what we did was we tried to use humor as a way to soften the very real and very terrible experience that a lot of people were going through. One of the ways we did that was by taking some of the things that trolls were saying and turning them into actual campaigns. It's one thing to just, put up a poster that says, be safe or stand 6 feet apart or whatever, which we also did. But at the same time, we also took a look at what other people were saying, like pull your mask up, or salads, if you eat healthy, you're not going to have a problem with COVID. And we took the things that people were actually saying, both in our comments and on the street, and turned them into campaigns with the science-backed information of all the professionals we had on our Slack channel.
And I think just to kind of uplift something about how to think about social media. Social media is incredibly important. It's necessary. People are on there. People are communicating on there. It's very honest. And sometimes that heat is incredibly intense. And so I always, shout out to mental health. If you're a communications expert, if you're doing comms in the public health space, take the time that you need, because you're gonna get, that heat, that anger. But I think that in between getting cussed out, there are legitimate questions there. And you're getting legitimate feedback. It's almost like real-time focus grouping all of your things. And so making sure that, and I think Benjamin hit it, on the head earlier, right? We have to make sure that we're differentiating between honest questions or hesitancies and people who just woke up one day and decided that they're going to influence as many people as possible to do something that's not in their best interest. And I think we did a really good job of treating people with empathy, as Benjamin said. And also, though, making sure that our page didn't become a place of disinformation and misinformation, right? Like, you have to acknowledge, you have to address, you have to go into the comment section. I think it was Benjamin who actually taught me, what your response is isn't necessarily responding to the person that you're responding to. It's responding to the next 3,000 people that come to your page over the next 2 days or 6 months or what have you, looking to see what it looked like and what the conversations were about. And so recognizing that you can't allow your own page to be a misinformation depot, while also recognizing that in between people yelling at you, there are questions. Engagement is incredibly important. And I think that was definitely one of our philosophies. And at the same time, we also just need to make sure that we're listening to our audience. To Benjamin's point, every meme that we put out came from someone in our comment section. Some of our, not just social media, actually, I want to take that back for a second. We also had public health experts telling us what they were seeing on the street, having conversations in real life with people. We had an entire community participation model where community ambassadors were asking people questions about vaccine hesitancy, what they needed. So a lot of our, a lot of our contact tracers, for example, were telling us things like, "Hey, people are going to restaurants, people are going to brunch, people are doing these activities without being vaccinated. What can we do to kind of uplift this particular situation?" And so we said, "Oh, we can probably do something interesting on social media about that." And that was sort of how sort of our early campaigns came about, from real life examples, from real life data, and that we were just able to be very honest, transparent, and also accurate about what we were trying to address.
And also, like, that came with being honest about stuff that we didn't know. Very early on in the pandemic, even with all the professionals that we had in the Slack group and all of the information that we were getting from the CDC and all the other national and international sources, we used sources from across the globe. If our local team didn't know something, we looked up the national data. If we couldn't get that, we would look internationally to see what other countries were doing and how they were answering things. We really did a lot of research for even if it was just a tweet, we did a lot of research for everything as quickly as we could. And if we didn't know something, we were honest about it, because having canned answers and even like doing the political thing where you pivot and deflect wasn't what people needed at that time. And so, very early on, when they really didn't know how fast everything was spreading, we were honest about that. And we said, listen, we don't know. This is what we guess the data is, but we don't know. And so we're trying to be safe, and we want you to be safe. And that is our entire goal. Everything that we did, Adam and I had a very deep conversation early on, trying to boil down the essence of what the health department was trying to say and what health department was trying to do. And it always boiled down to, we want you to be safe. And so we just started including that in every single message that we put out. Like, this is our goal. Like, because the conspiracy theories were wild. Like, it was, you're putting microchips in your arm and you're trying to control us, and it's racially based, and it's this and it's that. And we just kept emphasizing, no, the goal here is your safety. That's all we want. We care about you, and we want you to be okay. And even, like, whether it's you listen to us or you don't listen to us, we still want that for you. Whether you're going to yell at us or whether you're going to troll us or whether you're going to, take our information to heart, we just want you to be safe. That's the goal.
That's a great point, Ben. And you all touched on this just a little bit, but just to get more specific, so misinformation and disinformation were really quite rampant during the COVID-19 pandemic. Can you both share a story or an example of how you all handled misinformation or disinformation for Baltimore City Health Department that other health departments can draw inspiration from?
There's so many.
Yeah, right. No, I do want to reiterate some of the really important parts of, one, making sure that you're paying attention to what people are saying and how they're saying it, and responding as quickly as possible. I would strongly recommend, honestly, it's a good model to have even if we're not in a public health emergency, but a rapid response channel to be able to ask a physician, ask a doctor, ask an epidemiologist, "Hey, is this accurate? What and how can we push back on this in an accurate way?" I mean, that is so important, and strategically, to make sure that we're actively engaging and monitoring this information. But I think every single bit of information that we put out came from either a real person, right? Or a bot sometimes, right? Like somebody who had responded to our page who said something, and instead of ignoring it, instead of trying to hide it. I mean, there's also rules depending on what state you're in, depending on what your institution are. There are also rules about being government and not being able to delete comments, right? So like you actually do have to engage with folks, because otherwise they're just going to say what they want to say, and somebody will come back in and say, "Oh, well, if it's on the health department's page, it must be true." So again, going back to that engagement strategy of, even when somebody is wrong, keeping in mind that hate speech is there are certain rules for hate speech or cursing, etc. But I will want to say, a couple of great examples. I really did like the salad campaign, right? Benji, you want to talk about how that was taken?
Yeah, so we created a campaign, and it was called "Salad Doesn't Cure COVID," Connor, and it we used imagery that was very, very heavily inspired by um, really terrible infomercials and um, this Tumblr that used to exist called Bad Stock Photography, where it just, it took the most fake, ridiculous looking stock photography and just made fun of it, because there's a lot of stock photography out there that's not polished, that's just ridiculous. And there was this photo of a very sad gentleman with a lettuce leaf in his mouth. And I had found that, and I had recently been getting a lot of um, uh, commentary on our social media, which centered around healthy living. And there was this misconception early on that healthy people didn't get COVID because, if you were overweight, or if you had pre-existing conditions, that you were going to die from COVID. And we found out, much later, that that was not the case. Healthy people can get COVID and die just the same. And so there was quite a lot of misinformation that was just saying, hey, if you just eat healthy, you're fine. You don't need this vaccine. And so we created this campaign using this ridiculous stock photography as a direct response to those comments. And um, we did it in a way that, that was funny, because it got people's attention. Um, but it also helped talk about um, what actually helps. After we put that up, we were able to have some deeper conversations in the commentary, where we talked about, yes, healthy living is important. The health department will never tell you to not eat
And a
healthy,
salad, the health
right?
department.
Have some salad, but also get vaccinated too, because this virus is killing people, whether they're healthy or not. Um, and we were able to use that kind of humor, and that kind of the twist of the knife in a lot of different instances. We, like Adam said, we created an entire campaign around brunches, because people were like, oh, it won't hurt if I just go out with my friends just this once. And
Right.
so we made a campaign that showed a couple arguing about um uh one of the partners, being upset that their partner didn't think that they should go out for mimosas. And we just use those real life situations, but we use the photography to show how ridiculous what they were saying actually was.
And I think
Having someone with a lettuce leaf hanging out of their mouth is funny, but it's also like, that's really what you're saying, is that eating salads will prevent you from getting a virus. Like, that's ridiculous. And so we're going to show you what ridiculous is, but then also come back and be like, healthy living is important. Diet and exercise is important, but also getting the vaccine is important. So if you're going to listen to us about these other things, listen to us about this thing too.
That's such a great example. And I actually, when I lived in Baltimore City, I remember seeing that and I absolutely cracked up. I thought it was hilarious when I was like sharing it easily within my group chats. And, I'd learned that from Adam, like, that's when you know that, like, you've done it. Like, that's always the goal. But so, final question, what is your final advice for health departments now, during, and between emergencies? How can health departments better communicate with their audiences and build trust in public health in an environment of misinformation?
First, I want to say that if I was back at the health department now, I don't think I would go any less strong. I think that, yes, we are quote unquote between emergencies, but there are still other health crises in this country and around the world that we are still facing. I think, and Adam and I, started to get into this a little bit as as our time at the health department came to a close, where we started taking some of the focus and working on other things like sexual health and other kinds of diseases and health issues that were, that affect Baltimoreans. I don't think I think the intensity that we put into COVID is the kind of intensity that I would love to see health departments put into everything that they do. I think that is important, and I think that that is critical. As to, what's my message, I think, we've touched on it already. Lead with the empathy, you know, find people where they are, listen to them, figure out what their fears are and where they are struggling. Uh, don't be shy about the science. Use the science as a way to drive the messaging and make sure that everything that you say can be backed up. And if you don't know something, say that too. That's okay to say. To let the public know that, you have researchers and scientists and lab technicians all working on this problem is something that people need to hear. And then finally, I would say, don't be afraid to be real with people. The humor that we brought is the humor that Adam and I have when we're together all the time. It's the humor that good friends have with each other. And that's important for people to feel. You don't need to have everything all prepackaged and, in a particular font and Times New Roman printed out in a PDF. Like, it can be funny. It can be relatable. Don't be afraid to push the envelope in that sense, but make sure that you have the science and the empathy first before you just jump in swinging.
I agree with everything you just said. I would quickly say three additional things. The first is, I think our experience taught us the importance of experimentation, right? Making sure that your information is accurate is, I mean, that goes without saying. Like, do not put out things that you're not sure of. And to Benjamin's point, admit the things that you don't know. But experiment. Don't be boring. Or to put a fine tune, it's not even about being boring. I think many public health agencies, as a default, are engaging in one-way communications, right? Putting up this information, no follow-up, not engaging in the comments, not responding, retweeting, resharing, reliking, etc. So definitely, starting tomorrow, make sure that somebody is there actually engaging with people and having conversations, which is related to my second point. We need to fund more public health communications, right? Fund public health in general, but you cannot do this work by yourself. As someone who did it by myself for way too long before Benjamin came aboard. And so Baltimore City, I think, engaged in a really intelligent model, the Joint Information Center model, for the first months of the COVID-19 response. We, all communications professionals across the city, were essentially thrown into virtual rooms and said, hey, DPW, DOT, you guys do very important jobs, but I really need your designer to come help me do this COVID response stuff. And so we were able to very quickly pivot to a all city response model. I know that that's not all the time, but I highly recommend it as a practice, especially for an emergency response, making sure that folks know what a Joint Information Center model looks like and how to do it. And then the last thing that I want to say is really know your audience. And what I say by that is, when we were talking about sort of internal strategies early on, especially when it came around the vaccine rollout, I kind of wrote up a document of like, okay, there's going to be at least 4 different types of people who are talking about vaccines when they're first coming. The first are going to be, and I call them the where, the whens, the whys, and the waits. So the where can I get my vaccines were folks who were able to, based on, if y'all remember very early in the COVID-19 pandemic, you had to be of a certain age, you had to have certain pre-existing conditions to be able to get those first vaccines. So these are folks who are like, you don't need to sell me. I know it. Just tell me where to go. I'll get it. The next folk are the when, right? So these are folks who could be able to get the vaccine maybe in a week or two. They're just not in that first group. Again, you don't really need to convince them. You just need to provide the information. The whys are the folks who need a little bit more information. They need to be engaged. They need to be convinced. They need to have the data. And so this is where we spent a lot of our energy during the pandemic, really making sure that those questions were answered. And then the waits are just essentially folks who are like, thank you very much. I will read all of this, but I'm really going to wait 6 months or a year and just, see how this goes, right? Like these are the folks who don't buy their iPhone in the first 2 weeks of the new iPhone coming out, right? So you just acknowledge that, like, sometimes you're not going to be able to convince everybody in the same way at the same time. Bake that into your communications plans, and then that will make sure that you're addressing a variety of factors over the course of your outreach. Yeah, I think we did a pretty good job with the circumstances. Have fun, try to professionalize your communications departments. Don't give comms to an intern. Okay. I'm so tired of that.
Yeah.
It's such an easy, like, oh, it's a just a junior person that we just hired. We'll pay them $25,000 a year and they'll run the pandemic response. No, professionalize it. Hire good people, pay them well, because it matters when it comes to a public health emergency.
Absolutely. And this is all such great advice. I just want to thank you guys again for taking the time to chat with me today. And hopefully, some health departments can learn from your experience. So, thank you so much, guys, and have a good rest of your day.
Thank you. It's our
Thank
pleasure.
you.
Thanks for watching. And for more information, go to our Trust in Public Health website.